I've also made you into a moderator in case you wanted to make comments or also to advance the slides. That's great. Thanks, Susan. I can see that you've added the message there. That's great. As I say, the microphone is on when you see the little blue icon. Stan, I'm going to give a couple more minutes for people to arrive. I did anticipate to have about 20. We're, I think, around 10 now, so that's getting there. But we'll give it another moment or two. For those of you who are waiting, if you have not had the opportunity already, you can take a look at the draft list of the topics for this school mental health discussion group by clicking on the microphone, I'm clicking on the link that's in the agenda page there. It should take you directly to that page. For those of you who might not have read it in the background material, we're hoping that this session will be the start of an ongoing discussion and exchange. We've had a really good response to an invitation to about 25 international organizations who have knowledge exchange capacity in school mental health. So we're hoping that we can continue this on in a variety of ways subsequent to today. We're also joined by a group of about 70 who have been working on implementation issues in school mental health as well. So that discussion group is well underway, and it's led by a couple of other people as well.
Doug, I'm having the trouble in sending a text message. I typed it in and I push a button, but nothing happens. Any suggestions for what I might be doing wrong?
Okay, so it's in the chat box, and then you just press enter, and it should appear in the...
You know, I get all sorts of lovely icons, emoticons and soccer balls and rainbows.
Well, it's probably because you might have clicked that little button. That's don't click the button. Just press enter on your computer.
Okay.
It should.
No, that's still happening.
And I see that we're actually recording, so I'm going to begin the session, if I may. Welcome to everybody. It's Doug McCall of the International School Health Network, and I'm pleased to be joined by Dr. Stan Kuchar from the IWK Health Center in Dalhousie University. And by Yifeng as well, who is a colleague of Stan's at that center. So I was saying earlier, we're looking forward to a discussion that will occur in this session today and online through email exchanges, and then moving on to, I hope, to other webinars and other discussions. The purpose of the session today is to introduce a series of topics on school mental health that have been drafted as part of this international discussion group that we're starting up. There is the link there on the screen that you can follow. And please go to that link, and please do, if you have the chance, just click on the discussion section on that website and make a comment or to add your perspective in terms of the issues that we've drafted there. It's a very long agenda of topics, but we are hopeful over the next several months that we're going to be able to address many of them through webinars and draft documents and so on. This series of webinars has been sponsored by the Mental Health Commission of Canada as part of a series of sessions on implementation issues in school mental health. And so we're very pleased to be receiving that support and also pleased to be starting up this second phase of the conversation. We have issued an invitation to about 25 international organizations around the world, asking them if they would be interested in doing an exchange using the web. And we've received a very good response. Everybody has said yes thus far. So we have about 20 responses from organizations such as STANS, a university-based center, to organizations, NGOs who are advocating, professional associations who are advocating for school mental health or working on different research projects or managing projects in school mental health. So it's a really good set of sessions around the world. The challenge of doing this at any particular time in the day is to reach both Europe, North America, and the Western Pacific, is that somebody has to suffer, and so I'm really pleased to see Tracy. I'm sure, Tracy, it's about 9 or 10 o'clock in the evening for you in Australia, and for me on the West Coast, it's just coming up to 10 minutes after 4 in the morning. So it is a challenge. But as I was saying earlier, the digital recording is available, and people can advance through the session at their leisure, and the slides that are going to be part of Stan's remarks will be also posted on the webinar page that you will likely have visited in getting to this session. So, Stan, maybe I'll turn the discussion over to you, and to thank you again for taking the time to be here. Stan is a recognized expert on child and adolescent mental health. He's written many books and lots of journal articles. He's recognized as a collaborator with the World Health Organization and with UNESCO on the issue of mental health. And so we're really pleased that Stan is presented today and also has agreed to be the chair of this international discussion group. Stan, if you'd like to say hello and begin your remarks, and then we'll come back to discuss the different points in that potential agenda, and then talk a little bit about collaboration. Stan?
Great. Thank you very much, Doug. It's a pleasure to be here this morning, and I just want to thank everybody from wherever they're calling in from or joining in from, because it is difficult, depending whether you're in Australia or in British Columbia. And Doug, I think you take the award for being awake at the earliest witching hour, for sure. This actually is a historic day, because I think it signals that school mental health as a global area of focus is basically starting off, and it's starting off in very much a collaborative model, and the use of digital technology such as we are working with today facilitates that capacity for collaboration. I have recently had the privilege of leading the development of Canada's National Child and Youth Mental Health Framework, and within that, school mental health was identified as an important part of addressing a wider array of needs for young people in our country. And I'm certainly aware of tremendous initiatives undertaken in Australia, New Zealand, Europe, in the United States, and other places in which these activities are moving forward. And so it's really fortuitous that we're now having an opportunity to come together this way that can augment other ways that we can come together to help us understand our field better and to move our field along. I think that overall, when we think about school mental health, we can look at sort of two broad categories which are very closely integrated one to another. And I think part of our challenge will be to make sure that we integrate what we're doing together and not ride off into different silos. But one of the large areas is the enhancement of pro-social outcomes in young people and in their communities through the vehicles of schools. And the other big area is the enhancement of the ability to identify, prevent, and treat youth mental health problems or mental disorders which onset in young people. And that these two large and very important and mutually supportive components really need to come together in this context. The other thing that I think that we have to be very cognizant of is that we are in a fortuitous position of being able to build on a tremendous amount of knowledge and information and thoughtful discourse that has happened already. Doug has done us a tremendous job by pulling much of this together in his compendium of reviews, and if anyone hasn't seen that yet, I would highly recommend you look through that. I know in our own group, UFIN has just finished doing an exhaustive systematic review which has been submitted for publication on the impact of school mental health literacy as its own single topic. So there's a huge, huge corpus of knowledge out there that we can build from. And our opportunity is that as we build on this knowledge, we can improve it and we can take it in different directions. And that as long as we keep our eye on the prize, which is basically that school mental health is an integrated whole, we can hopefully avoid developing silos as we move ahead. So what I've actually taken the liberty of doing is Doug asked me to identify from our perspective 3 key issues of the day, and these are only 3 key issues of a number of key issues, and I'm advancing these 3 key issues for us to think about, and I'm hoping that other people will bring forward their key issues, and that one of the things that we might be able to accomplish at the end of this morning is to bring together all these different issues and then use another iterative model to enhance and explore them, so that maybe we can identify issues, key issues, not just 3, that we as a global community need to start thinking about. And what I've done here on this slide is I've taken the construct of school mental health and I've put it into a wider framework, which is part of an essential component for improving child and youth mental health. And in the paper recently I wrote focusing on Canada, but I think that this applies to everywhere, that there are at least 5 key areas that need to be addressed for child and youth mental health. The first is the development of effective policy. The second is enhancing evidence-based intervention through research and translation of best available evidence, and that translation has to be done in a manner that makes it useful for every end user, whether that is a young person or a health provider or a policymaker. That child and youth mental health care capacity must be enhanced in primary care. If there's anything in our healthcare system which is the largest barrier to providing effective and proper care, it's the inability to do so in primary care. Child and youth mental health has to be integrated into schools, both in the area of enhancing pro-social outcomes for young people and enhancing the capacity of schools to be safe and effective environments for the development of young people, but also to be part of the health identification and care system and not have to wait until everyone gets very ill before they actually access a silo health system. And then the final thing is the enhancement of child and youth mental health care capacity of all human services providers, which includes teachers, guidance counselors, but also includes obviously youth care workers and people who work in various different systems that impinge on young people. So I think it's useful for us to look at school mental health as being a really, really fundamental, necessary but not sufficient piece of addressing child and youth mental health needs, both in its promotion, prevention, and intervention components. The next slide is an interesting one. This is a compilation of the more common mental disorders, and I'm moving away from the enhancement of pro-social, emotional, cognitive, and behavioral components, and really focusing on mental disorders. And what we see here is that the age of onset of these different disorders is primarily in the adolescent years, and we define adolescence as 12 to 25. And clearly, disorders which onset earlier, anxiety disorders and neurodevelopmental disorders such as ADD and autism spectrum disorders persist into these domains. So what this tells us from the perspective of addressing mental disorders is that the school environment really has to be the location in which identification, support, triage, and even intervention can occur. So this does not mean that promotion activities and other components are not necessary. They have to dovetail with this, but we can't ignore this. In the traditional way in most countries has been to wait until young people have developed mental disorders to the point that they are brought to either the justice system or the health system. And what we need to do is to change that paradigm and to ensure that the major institutions that children and young people are involved in actually provide part of the solution to this problem as opposed to actually enhancing the problem. So we know from very good data, this is Kessler's work globally, you see the same patterns everywhere, that about 70%, that's 70% of all mental disorders can be diagnosed prior to age 25. And in Canada, young people are in one of two institutions at that phase of their lifespan. They are either in schools or they are in jails. And it is much better that we address their needs in the school setting and hopefully be able to prevent the other institutional outcome. So we also know from the WHO data that the burden of illness impact for young people is in mental disorders, and about 1/3 of the global burden of illness is in mental disorders in young people, which is greater than HIV, AIDS, tuberculosis, malaria, and war combined. So really, here the school setting must be a fundamental part of an integrated whole to meet mental health care needs. So here are three of the key areas that given that this is the data, that we are suggesting become part of the list of key areas that we as a group will need to start thinking critically about. One is effectively linking school mental health activities into a seamless pathway to care, and by that I mean a pathway to care for not just mental disorders, but those kind of interventions which can enhance a variety of positive long-term outcomes. The second is promoting, creating, and delivering effective mental health literacy to address knowledge, attitudes, and help-seeking behavior. And school really has to be the place for advancing mental health literacy. Certainly in Canada, the data that we have shows us that mental health literacy in the population is abysmally low, and we really need to start improving that, not only through programs directed at populations currently, but really have to integrate it into school settings. And the big research issue that we have to address is to identify and promote common use of validated and appropriate research methodologies, tools, and evaluation frameworks. One of the things that we are finding as we are conducting our systematic reviews is the plethora of different kinds of approaches, different kinds of measurements, different kinds of research designs that are used all around the world, making it exceedingly difficult to compare studies and exceedingly difficult to determine whether or not some of the measurements actually are valid or measure what they actually purport to measure. So those are three of our top-of-mind areas, but certainly not the only top-of-mind areas. So I'm just going to share with you a model that we've developed and are instituting in a number of different locations across our country, which is a modular component. So it's not a program that is to be delivered with fidelity, which itself can be a problem, but a program concept which is made up of multiple components. If students and teachers really are the foundation for mental health literacy, and we have a national school mental health curriculum which has now been extensively field tested, shown to be effective. and is being rolled out in numerous schools across the country. We have training programs for student services providers and teachers for identification, triage, and support of young people with mental disorders, and linkages to a whole host of other services that can be either school-based or community-based that can bring young people and these service providers together in a seamless way. So this is illustrating the pathway to care. And if you're interested in this model, IUFN will be sending the description to people. It was just recently published in the McGill Journal of Education. It provides an interesting conceptual framework that brings together mental health promotion, enhancement of school environments, and all these different components on the pathway to care for young people who do have a mental disorder. So one of the really important things that we are working on, and I think that we're amongst many in the world that are working on, is addressing mental health literacy. We really feel that this is the fundamental bedrock for everything else that we do. And here is the definition of mental health literacy that we will all be familiar with. But basically, it's knowledge, attitudes, and help-seeking behavior. The important thing from a larger systems perspective is to ensure that when help-seeking behavior occurs, that the proper help that young people need is available for them. So one of the things that I am working with in our group here in our setting, which is an academic and clinical setting, is the development of the capacity of primary care providers to actually provide the proper care that's necessary once kids are identified. So again, just to reiterate that mental health literacy is the foundation for everything that we're actually thinking about in every single aspect of school mental health. And I think that now there are some very interesting and exciting advances in this area, and I'm hopeful that one of the things that will come out of our discussions today is an opportunity for people who are working in mental health literacy around the world to share their experiences, and so that we can start working together to create some core components that we can then use everywhere. We know that the mental health literacy is not unique to schools, but it does certainly provide an opportunity to start building from schools out into communities. And we're finding, for example, with our work, that parental mental health literacy is now a major issue that we're having to deal with. Media mental health literacy is a huge problem in Canada. But again, we have to start somewhere, and schools and teachers and students is a really good place to start. Just data from a very recently completed, and soon we will publish this, shows that we have created this mental health literacy program called a high school curriculum, which is for grades 9 and 10 in Canada. And we have a teachers training program, because when we were field testing this curriculum, we found that without a teachers training program on the curriculum, the teachers couldn't teach the material because they had so much stigma themselves or so much misinformation. This is the results of almost 100 teachers who have taken the curriculum training course, and what it actually is fascinating, and it shows that there's statistically significant 0.01 improvement in knowledge on the basis of the one curriculum training day-long session. But the other thing that was really gobsmacking to me is that there is a statistically significant improvement in attitudes. So the training component, the mental health literacy component, at least in this early studies, is suggesting that not only can we enhance knowledge in teachers, but we can actually change stigma in teachers, which is an outstanding finding. And if other people are able to find the same things, I think we're really starting to move in a more sophisticated way in addressing this whole area. The other thing that, and the last thing that I'm going to talk, because I have a few minutes to talk, is just to illustrate to us how important it is that we use exceedingly rigorous methods for evaluation, and that I have been gobsmacked by reading the literature at how variable the study designs are and how variable the standards are used by different authors for determining efficacy or outcomes in the various studies that they have done. This is a problem for us because it's not uncommon to pick up a paper and say something shows effectiveness, and then when you actually read the paper, there's absolutely little evidence of effectiveness. Here are some domains that people on this call are probably familiar with. There are others, but I've just put these down for illustration. In the Oxford and the grade system, obviously we know are ways of analyzing specific research studies. I'm not going to go into them in any detail. They're both useful, but they are not the same. And in fact, studies which meet level 1 criteria for Oxford are actually probably as a whole better than studies that meet the top levels for grade. But what I want to do is I've just taken a particular corpus of studies around one school-based program, and I've applied the 3 different evaluation frameworks, the What Works repository framework, the Society for Prevention framework, and the Chambliss criteria framework, to the same body of knowledge, just to show you what happens when you use the different criteria for looking at program effectiveness. And the program that we chose was the SOS program, which is the suicide prevention program in the United States. Very, very popular, very common. Unfortunately, has no evidence that it actually prevents suicide, but doesn't stop it from being marketed widely. If you apply the SOS suicide prevention program data using the What Works repository framework, the analysis using that framework shows that there is insufficient evidence for us to conclude that the program could be effective or ineffective. And insufficient evidence, you'll see on the scale here, is the second from the bottom. It's not ineffective, it's insufficient, not inconclusive, insufficient. It doesn't meet promising, effective with reservations, or effective. So here is a program hugely marketed, very, very common, but when you actually apply these criteria, it actually lacks evidence for application. If we take the same program data and use the Society for Prevention Research Standards of Evidence to evaluate that program, this is just the last slide of 4 slides which have taken every single criteria. It concludes that this program is not ready for dissemination. So basically saying we don't know if it's effective, we don't know if it's ineffective. The quality of the research and the type of research that has been done shows that it is not ready to be disseminated. And this is in contrast to the extremely wide dissemination that the program currently has. However, if you use the Chambliss criteria, which is the American Psychological Association Task Force criteria, the program comes out as probably efficacious. So here we see taking the same data set, looking at effectiveness, efficacy of a program, applying different criteria, and getting exceedingly different results. So this is going to be a problem that will bedevil our field, because when I'm talking to superintendents and school board chairs and ministers of education, they want to know whether something works or not, because they're going to be investing substantially in improving the health of young people, and they want to have some degree of comfort that what they are using as an investment will have a positive outcome. So we're just showing this particular little piece of example because it really does matter what kind of criteria that we use. And so part of what I hope over the next years we will be able to do as a community of researchers and scholars is really come to some conclusions and agreements about what kind of criteria we will be using to make these kind of very, very important evaluations. So I just thought I would underscore this, what is the threshold for evidence, by sharing with you a comment that one of the flight attendants on an airplane that I was recently on said as we were landing. She said to all of us, quote, "I hope our service has met your expectations, and if your expectations have not been met, well, then just lower your expectations." I don't think that that's the way we want to go as we move our field of school mental health forward. So again, our point number 3 for us to think about is really what are the research design, what are the measurements, and what are the evaluation frameworks that we're going to be focusing on and using collaboratively. So those, thank you very much for your attention so early in the morning or so late at night. Those are a few of what we consider to be key issues to bring forward. They are, as I said before, clearly not all the key issues. There are only some of quite a number of key issues, but this gives us a place to start from and to jump off from. So I'll turn it over to Doug so he can now move us along to the next phase.
Thank you very much, Stan. And I'm going to invite people to either use their microphones by clicking on the talk button in the upper left-hand corner and asking Stan or commenting either about Stan's presentation or about the issues that you think to be most important in terms of improving our practice or improving our research or establishing more effective policies. So please use the microphone or add the comment, make a comment in the chat box, and what we'll do is I'll read out the comment that we're addressing in the discussion coming forward. For those of you who have not had a chance to visit that draft agenda, there's many topics, potential topics in that discussion. Stan's identification of the three of the key issues, I think, is really picked up on some of those ones which are top of mind for at least me, but I'm sure for many of us. And thank you again, Stan, for that. So I'm going to invite you to make comments or to ask a question of Stan, either using the chat box, just type it into that little white space in the lower left-hand corner, and then press Enter on your computer, and that will show up in the chat box there. And I'm going to take advantage of the fact that I do have a microphone and ask Stan to comment on something that came to me as I was doing that compendium of reviews. And for those who have seen it, it really is just the first stage of work, and Stan and Yifeng's work looking at reviews in much more depth is I recommend that highly to you, as well as work that's been done by a number of organizations around the world looking at reviews. So I'm not suggesting that my work was anything. In fact, it's really just a preliminary step. But one issue that came to me as I was looking at it, and a number of authors have commented on, is that the question of whether or not multiple interventions are being coordinated, and Stan's raised this in his remarks. The evidence seems to get diffuse as we try to bring together a number of multiple interventions to try to influence not only the health the health outcomes of young people, but also to look at how we might be changing the physical and social environment in the school, or in the neighborhood, or in the families. And I recognize that, as you know, research reviews, systematic reviews, must go to the random control trials. But there were 3 or 4 people that commented on whether or not multiple intervention approaches were more effective or less effective than really focusing in on a couple of interventions. And for me, that's been gospel for about 25 years of my life. So that made me want to see how research can be trying to address that. And I think it's important as a challenge to this area, because it seems to be clear in other areas when you look at physical activity and nutrition, or a number of other, sexual health and so on. The evidence seems to be clearer, but in this area it seems to be a bit diffuse. Stan, do you want to comment on that? Is that an accurate understanding, or is it also a challenge for research in the future?
I think you put your finger on one very, very contentious but fundamentally important issue, and that is more better than less, is every piece of more the right thing? Are parts of what is more helpful than other parts? Are parts of more less helpful or harmful, but that is being lost in the larger more? Recently, I was asked to do a systematic review of residential programs for young people with behavior disorders, and that was a fascinating process because I went through not only all the evidence, but I went through the history of the development of the programming. And what I found is that things were added topsy-turvy because the people felt it was a good idea. And by the time that you had these very comprehensive, hugely expensive, and very complex programs, number one, there was concern about whether the outcomes were as robust as you'd want them to be, but also it became impossible to say what, if anything, was actually in those programs that was leading to those particular outcomes. So I think that this is an area that we have to look at very carefully for fruitful research, and I think it's an area that we have to parse out very, very critically. I think there's good evidence to show that universal approaches to some things actually may not be as effective as we'd want them to, and then there is the final big issue that we always have to start moving towards addressing, and that is cost effectiveness. So the three sort of domains that we're struggling with is effectiveness of interventions, safety of interventions. I don't think one of the things that has struck us as we started to review our literature is that there has not been a lot of attention paid to the safety of interventions. I think there's an assumption that's made that psychosocial interventions, whatever they are safe. We certainly know from the psychotherapy literature that that is absolutely untrue, that there are all sorts of psychotherapeutic interventions which have proven to be not just not effective but harmful to people. And I think that our field has to start thinking about safety as we put in interventions. And then the other huge issue that we have to start addressing is cost effectiveness. How can we show that what we are doing is actually cost effective in the short term, but probably more importantly in the long term? So those are huge challenges for us.
Okay. Thanks, Dan. Again, asking people if you have a comment or a question about what are the key issues related to school mental health promotion, please add them to the chat box, and I'll repeat them out if you I'll voice them verbally if you like, so we can talk about them further. And if not, I'll please add your comments now as we're waiting. And I'm going to again take the liberty of adding another kind of comment. It goes to the series of webinars that we've been doing in this area. And Stan and I were chatting yesterday or the day before about this, in terms of the challenge for this issue of school mental health, but for all issues, is capacity and sustainability of programs, and it goes to the cost effectiveness issues and the system change issues. The series, there is another international discussion group that our network has been sponsoring, and we're very pleased that it's being led by Louise Rowling out of Australia, Audrun Samdal from Norway, and Martha Deschênes from Quebec. And all of those three leaders have been trying to flesh out a number of aspects of implementation and capacity building and sustainability, and some really interesting conversations that have come out of that. And I'm really struck because I'm a former teacher and kind of a advocate and practitioner, not a researcher. I really like to go to the nuts and bolts. And a couple of things we've learned from that is how variable. One of the things is how variable things can be in a system as complex and as ever-changing as schools. And we had a presentation from a woman in the United States, Linda Dusenberry, about it was about sustainability and fidelity to programs, and she cited a recent study, just December of 2011, which reported on how many schools in the U.S. are using what would be called evidence-based programs. In other words, they've been evaluated and shown to be effective. and how many have taken that effective kind of a program and implemented it well. And the report cited that 3.5%, in other words, almost 97% of schools in the U.S. were not using an effective program or not implementing it well. And then she went on to describe her work in working with teachers and how because of their work situation, because of their work life, it is almost guaranteed that they're going to be varying their lessons every year. They're going to be choosing different lesson plans, and because otherwise we can't expect teachers to teach the same lesson plans for 25 years. They're going to change things. They're going to be changing teaching assignments. Teacher turnover is a big issue in many jurisdictions, and so how do we address sustainability issues and variability issues as we try to follow what we know about what the evidence is saying in evaluated interventions, and that's a real challenge. And so how do we deal with that? And Stan, I'd ask you to comment a little bit about that sort of ever-changing ecology of schools that we're working with. And I see Tracy has reacted to that, saying that the reality that Mind Matters in Australia has operated from is that programs need a lot of flexibility going into that kind of ever-changing environment, and of course, and that's a challenge because we need to know that we're also doing things that work. And so, Stan, do you want to comment on that as well?
Sure. I think that Tracy's point is very well taken. We really have a dilemma, and the dilemma is that one of the criteria that we tend to use, even after we determine that a program may be efficacious, is that we demand fidelity in application. The reality is that the environment of a particular school may be completely different, even though that school is 2 kilometers from another school. And so we have a challenge: is how do we address this fidelity concern in a way that actually makes sense in real life? One of the ways that we have tried to do that is to use a modular approach in our model, in which different components are there, and that the components can be applied given the reality of the situation that they're in. And the fidelity is to the model, not fidelity to every single component. Now, it's going to take us a number of years to see if that different approach will bear fruit. The other thing that we are starting here in Canada, I'd love to hear what people in Australia and other places are doing on this, is we just applied for a large grant to redevelop a repository, not in your typical kind of repositories that are out there, but a repository based on requests from schools who say, this program is being marketed to us, can you evaluate and review the program using the highest standards of evidence? We're using the What Works framework. And give us your opinion based on that in a very independent and critical review of where the program stands on this spectrum of readiness for implementation. So, I think the other issue that we have to deal with is there are repositories out there. Some repositories simply list programs. Some repositories apply a type of criteria to them. There's tremendous variability in those criteria that are applied. So I think that that's an issue that we're going to have to grapple with. I'd love to hear how other people think about that.
Thanks, Dan. And I'll just reiterate what Tracy has added to her comment, that the data that can be collected or relatively easily collected from schools to monitor the impact of well-being programs on student feelings and adults. I think that's an important aspect, is being able to provide tools to schools for monitoring and improving what they're doing, and that may not have the rigor of a formal evaluation, but is still very important for them to make progress. And I guess to add to that is monitoring, and then I know we've had discussions of this in other webinars, and is monitoring progress in terms of student health and well-being and student behaviors is very important, but also monitoring changes to the environment of the school, the physical environment, the social aspects of the school, the policy aspects of the school, the teaching practices, the way the schools are organized, and then moving upwards into the systems, because schools are controlled by systems, as changes at the school board level, changes at the mental health agency level. Those are very important to monitor, and we don't have good ways of doing that, monitoring changes in the environment of schools. So I'm hoping that one of the things we can talk about in the future is that area as well. And then I have, Ella's added a comment that and again I'll ask Stan to respond to it. It's a challenge to obtain the support and buy-in from departments of education to achieve national implementation, because implementation of evidence-based programs, because of the issues of sustainability and cost. I'm assuming, I'm reading that into your comment, Ella, is that's the often where the rubber meets the road as well, is whether or not ministries or school boards or other health authorities can actually commit long-term to building that kind of sustainability. Stan, do you want to comment on that?
Well, I think that point really strikes to the heart of one of the big issues in the matter, is that success in all this becomes a political, it basically is a political phenomenon. And in our democratic societies, it's the bureaucrats that run the countries, and the politicians are supposed to impose the will of the people on the bureaucracies. So there's always this robust dialectic praxis phenomena that's occurring between the people, us, the politicians, our representatives, and the bureaucracies which actually run the programs. So it becomes exceedingly complex, and this is one of the barriers to success, which there's a lot of people are not talking about, and we have to sort of try to get our heads around that as well. And when I'm thinking about that point, there are three sort of issues that strike me, and I'd love to hear what other people think about it. And that in the educational system, their ideologies or ideological-based biases, beliefs, or truths have a tremendous foothold, and that the use of evidence to challenge the belief systems, or the use of evidence to challenge opinion in the educational field is, to me, as a relative outsider, not well accepted. Part of the whole framework of how educational systems are built and what they produce. The other thing is that, as in many other systems, interest groups prevail, whether those are professional groups such as teachers or unions and teachers organizations, or whether they're parent groups or whatever, so that we're always dealing in a setup where we have shifting interest group interaction. And then the other thing that education systems are rife with is the issue of identity politics, and that different groups, be they disadvantaged, vulnerable, unique in some way, see the education system either as a vehicle to achieve integration and success, or as a vehicle to enhance identity. And so when all these things are put together, this makes the application of evidence-based approaches exceedingly complex and exceedingly difficult.
Thank you, Stan. I'll just pick up on the comment that Tracy has added about the governance structure in the Mind Matters program in Australia, and that's I think one of the strongest examples of a national and state cooperation. Is that since its inception, they've used reference groups or coalitions at each state and territory that bring together a number of different organizations, and that is an important part of capacity that was identified in a model that we've worked on with our international network. It's an adaptation of a model initially developed by the World Health Organization. It's actually was one of the presentations we had earlier in this series, and our next session, which is on September 16th, an hour later, is going to have a presenter who talks about how one can initiate and sustain those kinds of reference groups or coalitions, and having both formal cooperation among agencies as well as informal cooperation through those kinds of groups is a very important part of capacity. And so that's the kind of conversation I think we need to have, is how can we not only get those groups started, but how can we keep them going like Australia seems to have been able to do. And so I'm hoping that we can learn from each other in that regard. Again, Stan or anybody else with a microphone or wanted to add in the conversation by typing, please do so. We all need to get microphones with headsets. Please do so for the next session. I'm smiling as I say this. This is a really challenge for me to be articulate at 4 o'clock in the morning, so please help me out here for the next session by buying a microphone and plugging in on your computer. Further comments from as we might move to the closing part of this discussion and the future part of this discussion. Stan, do you want to add a thought about the point that Tracy's raised?
Well, Tracy, I would love to hear more and a lot more detail from Tracy about how you're doing this and how you've achieved it and what the challenges are that you face and how you've addressed those. You're ahead of us, and I would love to be able to learn from you, because we are just right now in the process of trying to drive out some programs across Canada. We don't have a federal structure in Canada in which education is even a shared federal responsibility. Education in Canada is a distinct provincial responsibility. So one of the big challenges that we have for our national framework is how to get all these different provincial groups who spend most of the time squabbling with each other to work in some kind of quasi-collaborative way. So Tracy, I'd love to learn more about what you're doing and how you're doing it. It would be a tremendous help to us.
And Tracy's responded to that by saying that federal, provincial, we call them federal, provincial politics in Canada, but state and territory jurisdictions in Australia. And that's great. Well, Tracy, I will follow up with that, and maybe that's a topic for us to add to our agenda, is that multi-level kind of discussions that needs to occur among authorities. That can sometimes, the wheel can be greased by having good participation from professionals and NGOs, but that would be really good. I will follow up on that for sure. I know Yifeng was asking Joellen, Joellen has joined us a little bit late, and Joellen, please jump in with any questions, either if you have a microphone. Okay. Thanks. There we go. Yifeng's right on the ball, watching hands coming up, and that's great. So I'd like to move to our next phase of discussion here, and just to indicate Stan and I were talking about this before. And Stan and Yifeng have already written about this, about the need for global collaboration. In late March, or in about March 20th, we sent out an invitation to about 25 organizations, and we emphasize organizations who are doing knowledge exchange in school mental health and have web-based tools that they've been using. And we've been really pleased by the response. Everybody has said yes to cooperating, using the web to exchange knowledge, to exchange information. And so it'll be a process over the next couple of weeks that we'll follow up with individually. But we wrote to research journals, we wrote to large organizations such as CASAL and others, Mind Matters, big programs like that. We wrote to university centers like Stan and others and asked them if they would be willing to participate. We wrote to agencies like SAMHSA and the Mental Health Commission, and everybody has said yes to the idea that using some of the web tools that are now available to be able to have an ongoing discussion. And so I'm just going to see if I can add a page to our, and then I'm going to see if I can paste in the list of, yes, it does work. Just give me a moment as we, just to see the number of organizations. You should see them on the screen there. There's just I don't think I'm going to have enough space, but there's 25 organizations, over 25 organizations who were invited, and you can see them if you slide that bar up and down, from the International School Psychology Association to several journals, Canadian and School Psychology Quarterly. We have a number of the research alliances in different countries, European discussion groups, and so on. There's a number of people, all of whom have said yes, that they would be willing to participate. They are all in the process of, as we all are, learning how to use these tools. And so it's been very exciting to see the response. And I guess the next question is how we can do this. And so we will be proceeding with individual conversations. I'm hoping that a couple of organizations from different parts of the world might join Stan and I in taking the lead on this, because one of the things our International School Health Network is trying to do is to partner with sectors like school mental health to help facilitate these international dialogues. But our little International School Health Network does not have the capacity nor the content expertise to take the leadership on issues like mental health. And so Stan's agreed to start this group, and if there are a couple of people, organizations who are willing to, 2 or 3 groups to work with Stan and I to do that, it would be really good, because the leadership has to come from people who know about the issues. Our network is going to try to focus on gathering the kinds of stuff that we've been able to do through our various activities, watching the journals and so on, and be kind of a collector of a lot of data, a lot of presentations, a lot of research. Just keep collecting, and if people who are into this issue as experts and as advocates, if they could then help sort and select that massive flow of information and then help to share it in different ways, that would be really, really exciting. And if you look at that list of organizations, to say everyone has said yes thus far. We're up to about 20 now, and so I'm really pleased to be able to follow up on that. And we will be asking those groups perhaps to report on their work or their experiences we've learned today in webinars. There's a lot of people using webinar technology now. We don't have to use our particular platform that we're using today. We don't even have to have, and with digital recording, we can also link to webinars that are occurring elsewhere. We can bring them into a listing so people can move between issues and make the linkages between issues. So webinars are one forum. We're going to explore. There are a number of other really easy tools to use, and what I call the 5-cent solution rather than the $5,000 solution. We've been using Twitter accounts more like email, not as discussion groups, but we've been just simply cutting and pasting reports, documents, articles into a Twitter account. And that Twitter account can either be reposted, retweeted as they call it, into other Twitter accounts, or that Twitter account can be easily displayed on anybody's website and updated automatically. And so there are a couple of ways of using Twitter just to flow the information around the world as we all find it. And if we all have Twitter accounts, or here's the 5-cent solution, simply use the same password, jump into Twitter, post an item, and then jump out. That's a real easy way of getting it into the flow of information, and if it appears on 20 or 25 websites, then it's a way of getting it into a number of different audiences. In the same way, we've learned a little bit about how to have a blog that appears on multiple websites. There's no cost. It's just it's just actually what they call an iframe, and basically you just take this little bit of code and drop it into a frame on your website, and then the shared blog or the Twitter feed then shows up automatically and is updated automatically. So real cool and no cost. And of course, those of you who have had a chance to see the materials that we worked on, there is a Wikipedia-style bibliography that we're trying to build so that people could add to that bibliography and select from that bibliography to create different sets of readings and collection of resources and so on. That would be another easy tool. The wiki technology allows anybody to go in and just add an item or make a comment, and again, that's real easy to use. So we're really pleased to see the response, and we're really pleased to be able to say that it looks like we're going to have these 20 or 25 organizations finding ways of having having information flow easily to everybody. And those of us individually can then simply follow a Twitter account by having our own account, or simply showing up on a web page of our choice and being able to track it there. So I'm very excited by this, and wanted to thank those of you who are online, but also thank people who will be visiting the digital recording of this session, that this is going to be a great opportunity for all of us to learn from each other. And as I say, if a couple of organizations would like to work with Stan and Yifeng to help to take the leadership around the content, that would be really super. So if you wanted to let me know by email, that would be great. And then also, so to maybe stop and give Stan a chance to comment on that, and also then to anybody else. If you can type it into the chat box, please let us know as well that way. Stan?
The way that we can get everybody's email addresses and flow back and forth to each other and the locations. I see the list of names here, some of whom I recognize, some of whom I don't. It'd be great to have their contact information. Doug, is there a way to share that with all of us?
Absolutely. The initial, the last email has a number of email addresses, but we'll shape that up a bit and then make it formal as we get people to sign on, to say yes, they will want to be part of this network, and then we'll circulate that list. And there is a way in the wiki that we're using to allow people to actually update that list by themselves. So if people change roles in an organization, that they can simply add the new person's name or email address to that. So we'll set that up as a way of moving forward as part of this international discussion group. We have the initial email went to those 25 groups, and we have those initial contacts. Actually, some people are naming people who can follow up, so it's just great. Further comments, questions about that process? Maybe one of the sort of little advert for the next session and for the next two sessions. There's one on the 16th of April at an hour later than today, 8 a.m. Washington time. And then there's another session which will be a little more easier on some of us, the final session, which is going to be looking at inter-ministry, in other words, at a provincial or state level cooperation in school mental health. And we have an excellent presentation coming from a project in the United States led by the National Assembly for School-Based Healthcare. They looked at capacity building at a state level and have an experience from several states that they're going to offer as a session. So that's on the 24th of April at 4 p.m. Washington, D.C. time. So those are two sessions, and that will be the final two sessions for the series that has been sponsored by the Mental Health Commission of Canada. And so I'm really pleased to be able to have those two sessions starting, but we'll also be able to follow up with others. There's some people have already volunteered, and I'm smiling as I say this. I'm going to be following up with Tracy about learning more about their program in Australia as well. So further comments or questions before we close up this session, please add them to the chat box. And I'll also, there's one last bit of interaction capability on this technology is if you look at just below your name in the list of participants, there is a little icon with a smiley face. If you scroll over that, and a menu will drop down, and there's a way of clapping. And so you can see that if you look at my name, I've just started a thank you to Stan and Yifeng who've prepared their remarks for today. If you would join me in thanking Stan and Yifeng for their presentation, and to thank everybody for participating at this early or late hour. As I say, I was expecting about 20-25 people today. I'm sure everybody will be following up with the digital recording. We've seen that happen in every other case, so I'm pleased that we started the conversation. And again, Stan and Yifeng, thank you very, very much.
Well, thanks to everyone, and Doug, very much thanks to you. I hope you have a chance to go back and get some sleep after all this.
Yeah, or at least walk the dogs anyway.
Right.
Okay, thanks, folks. If you want to close off the session, then